Good afternoon. My name is Diana Shenefield, and I'm going to be talking today about dispelling some of the myths that students have about the NCLEX exam. One of the things that a lot of students think is once they've graduated from nursing school, they are ready to take the NCLEX exam. As instructors, we try to dispel in them that it takes a lot of studying afterwards. There's no way in nursing school that we can prepare you for everything that nursing has to offer. One of the things the students have to understand right away is that the NCLEX exam only measures competency. They have been through nursing school. A lot of times the students think that they have to be experts to be able to pass the NCLEX exam, and that is not correct. So one of the things that we need to do is to dispel some of those myths that they have about being an expert and having to know everything about every field. And we talk to them a lot about competency. We talk to them a lot about looking for patient safety. It's so important that they understand that they are providing safe care, competent care, and that they are a patient advocate. So we always start out by saying, what are some of the myths that you've heard? And some of them always come up with, well, if it shuts off at 75 questions, you failed. If it shuts off at 75 questions, you've passed. If you have to take all 265, you must not have did very well. And so we talk to them a lot about how those feelings, those misconceptions can cause panic and can cause your mind not to think through the questions correctly. We know that there's a lot to be said about mind over matter. So we talk a lot about that. Also, we talk a lot about the timing of the exam. We know as professors and as professionals that the sooner you take the test after you've graduated, the better. We have a lot of students who can't wait to get married after college, and we tell them that you want to take the NCLEX exam while it's fresh in your mind, when a lot of other life things aren't clouding your attention span. And so we talk to them a lot about the timing. We also talk to them about the time of day. A lot of students think that they're told when they are going to take the NCLEX exam and that they have to go with that. And we talk to them a lot about knowing the kind of person that they are. If they're a morning person, they get up and they're ready to go in the morning, then the morning exam time is going to work for them. If they aren't a morning person, if they're groggy in the morning, if that takes them a while to get going, we encourage them to go for an afternoon exam time. And again, a lot of it is making sure that they have control, or they feel like they have control, and then that puts them more in the driver's seat. Another big misconception is I'll just cram the night before. We talk to them a lot about the fact that you can't just cram the night before. This is 4 years of college have built the foundation, and now you need to hone in on those skills. So a lot of them don't understand the time commitment that it takes to prepare for NCLEX. So one of my jobs as an instructor is to make sure that they understand that this isn't a one-night cram and go kind of test. Also, it goes without saying, but we do reiterate the fact that you must have a good breakfast or a good lunch before you go. Be well hydrated. Know that you've done everything physically and mentally to prepare for the test. Also, another big thing that they need to work on is computerized testing. Many of the students today think that because they can do anything on a computer that a test would be no big deal. The problem is what they sometimes forget is that you can't go back. If a question comes up and you're like, oh, I answered that question wrong before, you can't go back. So getting your confidence level to the point where when you push next question, you're ready to go on to the next question. Lots of schools have different programs. There's ATI, HESI, there is Houston. So there's a lot of tests out there, and I think most schools now use some kind of computerized testing that a lot of times the students think, oh, I can't do another computerized test. That's when they need to really be honing in on those computerized skills. Again, we cannot reiterate the fact that you cannot cram for this test. One of the things the students have heard over and over again is it's testing critical thinking skills. When you're taking a test, because the Board of Nursing only has one way to find out whether you are a competent, safe nurse, and that is by asking you test questions. So some of the ways that the test questions are built is to make sure that you're going to read through every question and that you are going to understand exactly what it's asking you. If you're the kind of person that only reads the first couple words and then hurries up and answers it, that might be an indication that you're not a person that thinks through their patient care. So that might send up some red flags, and there are test questions built for those kind of people. So make sure that you understand exactly what the question is asking. Make sure that you read through every answer. Even if you're sure that the first answer is right, read through every answer and make sure that you understand what the question is asking. One of the tips that I give to my students is that they give you a whiteboard. Use that whiteboard. Write down key words from the stem of the question so that as you're picking the answers, you can look down and make sure that you're pairing them up and then erase it and go on to the next one. But use the tools that they give you and make sure that you're giving the time and the respect to this test that is due. One of the things a lot of students think is that I've been through 4 years of school, I can pass this. This test deserves the respect. This test is what's going to decide whether you have RN after your name and whether all of that work that you've done is going to pay off in patient care. Again, mind over matter. If you go into the test afraid that you're not going to pass, that is going to cloud your mind. You need a clear mind. We talk a lot in nursing school about you cannot memorize, but you know what? There are some things that have to be memorized. You have to know your lab values. There's no way around that. Those are constants. They're always the same. So make sure you memorize those. There are some common meds that you've learned in nursing school. Make sure that you review those. If there's areas of the testing, if you're really good at pediatrics, skim over the pediatrics, but focus your time on where you are the weakest. Don't listen to myths like, oh, there's no psychology on it. OB's really small on it. Assume that your test is going to cover everything and study likewise. That's all for today. But you know what? We'll be back and there's a lot. But again, don't listen to myths. Go into it with a lot of preparation, and that way when you walk out and you have RN after your name, you know you worked for it. Again, this is Diana Shenefield, and I'll see you next time.